cervical cancer in Kenya is the leading cause of death. For example, today, since morning, we've lost almost about 3 women to cervical cancer. In a year, we lose about 3,200 women.
But it doesn't need to be that way. Cervical cancer is preventable and can be treated if caught early. We know that we can do something about it, but the challenges are hard. We know that awareness is low. We know that access to diagnostics, to HPV testing is low.
2/3 of women, by the time they're diagnosed, is stage 3. In Kenya, only 16% of women get screened for cervical cancer. So there's a real big gap from the WHO goals of 70% of women screened and then 90% of those treated.
We can do something about it. If we invest in the prevention of it through screening and early detection, then we are able to manage the disease.
There's a lot of stigma in general concerning cervical cancer. There are so many women out there who feel vulnerable, who feel discriminated in a way. So most of them feel like, how will people see me? How will they judge me?
The biggest challenge, one of them is lack of information, or rather misinformation. Maybe they think cervical cancer is brought about by witchcraft, which is not true. Another thing I must say, it's fear.
Before we started the HPV screening, patients could wait until they have signs and symptoms. That is when they come to the hospital because they already have a problem, because they fear the speculum.
Most of us ladies, they have that phobia of being going to the hospitals. You know how it is being done.
And so what we can offer is self-collection, something that can be offered in the home or a closer healthcare facility to make it more convenient, more private, and just more immediate to allow women to get cervical cancer screens. And so we're excited to be able to roll this out into the communities.
The new technology came with self-testing kits. That means any woman who comes to us, there's an option of self-testing. You will be taken through how do you do this, and then we'll get the results.
They benefit a lot from the self-test kit because when they come from a poor background and they're afraid to come to hospital, when you collaborate with them and they are able to allay their anxiety and to remove their fears.
With the self-screening, you see now you just bring the sample. When they have that, what we need to do is just to explain to them how to collect the sample. It helps, at least people feel now, I'm comfortable.
It is a game changer in itself. We actually trained about 750 healthcare providers, and therefore they're actually part of the healthcare cadre. So they were saying it's dignified. It's private. What it's done is actually increase coverage and access to cervical cancer screening.
Wow, that is a good idea, and it is good that it has come at the right time. It builds trust between the health promoter first, when you go to give them these stories, and then when you share on how to use it, they are confident enough because they know at least their privacy is not intruded, and then they are very free.
Kitu ya kwanza, lack of information. Most of them hawajui, but kupitia CHVs kuna ingine imetokea. Sasa hiyo ndio tunawaambia waende. Haya, wengine wanaona kama ni mzuri kwenda huko juu ya wengine wana save time. Si sasa ni ile yenye anapima peke yake, so anapata ni rahisi sana kwenda huko.
The self-test has really changed the lives of women because we have so many stories of women who at the time of our testing and detection was saved just because of them embracing the self-test kits.
HPV mwalimu, nilipata cervical cancer. Ningepata mahali naweza kuwa na kanyumba, niandike vacancy ya hiyo screening, encourage watu wakuje, wanakuja na wasomesa, alafu wanaenda hospitali wanatibiwa, naweza kuwa vizuri. Hiyo ndio plani niko nayo.
It's easy. It does not take a lot of time. You just pick the test, you swab, and then it's really good.
It was my first time. I went and did it by myself.
It is good because they will detect the HPV virus early. And therefore, we say cancer of the cervix is one of the cancers that when treated early, it's 100% treatable.
She said God really used you to come and save my life.
Why Kenya first? I think Kenya is a place where there is a high need for cervical cancer screening. There is a high burden, but there's also a lot of great infrastructure.
One thing that is so critical from Mama Lucy Hospital, they are seeing a significant burden of HPV other types beyond 16-18.
We need to start doing extended genotyping so that we understand what these others means.
What I liked about this platform is that we are able to unpack the genotypes. It's able to pick 16 separately, 18 separately. Now you're able to know that this is 55, this is 33.
The OnClarity assay is an extended genotyping assay. It's possible to decrease resource demand by 30 to 60% for precision management.
The integrated women clinic in Mama Lucy reduce the congestion, and now women can receive the other services.
We have to eradicate cervical cancer. This program is just getting started. We are really looking forward to continuing to roll out the program and to scale up across Kenya and across Africa and across the world.
I would want them to embrace this because it works and it saves a lot of time for the patients. And also it reduces the workflow and the workload for the hospitals.
When patients come, we give them the kits. They go home, they do it at their convenience and bring it. So we don't have crowding in our units. That has enhanced our efficiency in terms of screening, but it's a good thing.
Kenya has hacked it. We have a model that we've piloted and it's working, that is end-to-end, reducing or eradicating all the barriers that have been a challenge. I'd encourage them to come and visit with Kenya.
The impact of the work that we do and the impact that it would have long-term towards eliminating cervical cancer, like forever, just keeps me up and keeps me going.
If we can reach 90% of girls and get them vaccinated, if we can screen 70% of women with a high-quality test, we can do that. And this program is designed to help us reach those WHO 90-70-90 goals.
You're saving our sisters, our mothers, our aunties, and the community at large.
Kansa ukienda mapema haiwezi kuua.
Mimi ile yenye nitashika nitasema I'm for the hopeless.